All right, everyone, let's talk about this. Just today, the World Health Organization released an update on Omicron. They're talking about how they designated a variant of concern. And basically, they're saying that they don't know anything, which is true, which is we talked about in our last video. It is not clear whether Omicron is more transmissible compared to other variants, including Delta. The number of people testing positive has risen in areas of South Africa affected by this variant, but epidemiologic studies are underway to understand if it is because of Omicron or other factors. So they're saying we just don't know yet. Now, early evidence from, if you want to watch the previous video, I'll link it in a card, but early evidence says that it is more transmissible than Delta. It does seem to be outcompeting Delta, but that is very early preliminary information, and that may turn out to be wrong on further analysis. So that's true. The jury is kind of still out. Although, if you were to bet right now, you would bet that it is more transmissible than Delta. Okay, severity of disease. It is not clear whether infections from Omicron cause more severe disease compared to infections with other variants, including Delta. So Delta ended up not being more severe than the previous variants. It was just more transmissible. And we don't know if Omicron is more transmissible and more dangerous or just more transmissible, or maybe neither. Preliminary data suggests that there are increasing rates of hospitalization in South Africa, but this may be due to increasing numbers overall rather than a result specific to Omicron. There is currently no information to suggest that symptoms associated with Omicron are different than those from other variants. Initial reported infections were amongst university students, younger individuals who tend to have more mild disease, but understanding the level of severity of Omicron variant will take days to several weeks. All variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe death or severe disease or death, in particular for the most vulnerable people. Thus, prevention is always key. Okay, so they're saying, again, they don't know because most of the patients that have gotten it that they know have Omicron are younger people. They tend to do well anyway, so it's really hard to tell. And then they don't know effectiveness of prior SARS-CoV-2 infection. So does natural immunity protect you against Omicron? Preliminary evidence suggests there may be increased risk of reinfection. People who have had previously had COVID-19 could become reinfected more easily with Omicron compared to other variants of concern, but information is limited. So we're going to know this more because it's running through South Africa, and as they collect their epidemiologic data, if they start seeing lots of people that have had previously had COVID-19 get Omicron, then they'll know that this is more likely to get reinfected. So natural immunity will not be as effective for this, but we don't know that yet. That's going to probably be available within a week or two. Effectiveness of vaccines. So again, this testing is underway. And then effectiveness of current tests. The TCR tests continue to detect the infection, so the PCR tests do work for Omicron, so that's fine. And then effectiveness of current treatments. So, the non-specific things like the corticosteroids and immune suppressors, they are going to be probably work the same way, but specific things like monoclonal antibodies, we don't know. Those may be less effective. Things like molnupiravir and the new protease inhibitor drug that Pfizer is putting out, those probably will still work. Okay, so that's where we're at. And so this is the only primary data we have so far. This is the daily hospital surveillance report. So I'm going to make this full screen so we can look at it a little better. If I just checked it for Gauteng. So I'm just going to check it for them. So you see, like if you look at the whole country, hospitalizations have been dropping off. But if you just specify for Gauteng, which is the area where the Omicron variant is running, you see that in the past 2 weeks, there's been an uptick. So there is an uptick in hospitalization. So we don't know if this uptick in hospitalization is because Omicron is more dangerous or if it's just because there happens to be more people infected. So percentage-wise, it's the same. So we don't know that. That information will be coming out in the next couple of days. And then what countries has it been found in? Okay, so obviously it's in South Africa. The other countries that it's in is Australia, Italy, Germany, Netherlands, Britain, Israel, Hong Kong, Botswana, Belgium. So with South Africa, that's 10 total. And then there's an updated article from Wall Street Journal. This was just updated an hour ago. And you can add two more, Canada and Austria. So there's 12 countries total that Omicron is located in. My guess is it's already in the United States. We just haven't detected it yet. The issue is that international travel is so common now, and people are flying. There's multiple flights in and out of every country to every other country every day. So it is near impossible, unless you're a very small country with like a single airport, to control movement of people and disease these days, which makes, this is one of the reasons that pandemics are going to become more common, because of two things: increased urbanization and increased international travel. And those things make it so that any virus that appears anywhere in the world is most likely to go global. So what I found, yeah, so right here, Dutch officials confirmed 13 cases of the new variant uh, on just two flights on Friday. So that was 2 days ago. So if you just have 13 cases out of two flights, that means that almost every flight that came out of that area probably had at least one person, just statistically speaking, one person with COVID, with the Omicron variant. I suspect this is global. In the next couple of days, you're going to see new countries added that have it. Countries are putting these travel restrictions in place, and I think it's probably not a bad idea, but it definitely doesn't stop it. It may slow it down a little bit, but with the rate of international travel these days, the cat is out of the bag, and every country is going to need to deal with it, and it's going to be everywhere. There's a few countries that have very strict quarantine procedures, like New Zealand, South Korea. They may be able to hold this at bay a little while longer, but it's a losing battle, and eventually everyone's going to have to deal with it. So I would say, based on what we know, which is almost nothing, it does seem to be more transmissible. If someone is a higher risk, now is probably the time to assume that it is in the United States or in whatever country you're in, especially if you're in a large city like New York, Chicago, Los Angeles, Seattle, those kinds of large cities that have a large international airport. It is most likely in your community, and probably a good idea to kind of stop some high risk activities like gathering in large groups, eating inside restaurants, that kind of thing, um, until we kind of get a better handle on this thing and to see how dangerous it is. It may turn out to be a lot of nothing, and I hope that's what it'll turn out to be. But probably if you're in a high risk group, and now is the time to be a little bit more careful with social distancing and just keeping away from higher risk activities, because we just don't know if the vaccines are working well for this thing, if natural immunity is working well for this thing, and if the monoclonal antibody therapies will work for this thing. So, yeah. So as more information becomes available, I'll do updated videos on this, because I think a lot of people are interested in it, and I'm certainly interested in it as well. Thanks for watching.